Kinesthetic learning exercise now to look at the muscles of the anterior thigh. So these are the muscles that are going to be responsible primarily for knee extension, but a few of them are also going to cross the level of the hip, and so they will also be involved in hip flexion. First group that we're going to look at are the quadriceps femoris muscle. As the name implies, this is a four-headed muscle responsible for extension of the knee. Breaking it up into its four different bands, we'll start with the deepest first. This is the vastus intermedius. What's interesting about this muscle, it has a very large origin point all along the anterior shaft of the humerus, the largest of all of the origins. But because of its position deep to the rest of the muscles, it's the one that's least visible during the dissection. So it is there, but you're not going to see too much of it. And then it runs into the patellar tendon, which attaches to the superior end of the patella. Next, we have the vastus lateralis muscle. This has an origin. We'll draw it on the right side of the diagram first. It actually comes off the back of the femur on the lateral edge of the linea aspera. And then from there, we'll draw it on the other side, it comes around and somewhat overlaps the vastus intermedius to attach to that patellar tendon. Similarly, we have the vastus medialis. This muscle is also going to originate off of the posterior aspect of the femur, in this case on the medial margin of the linea aspera. And from there, it's going to wrap around and also attach to the superior margin of the patella. What's interesting about this muscle is when we get down towards the knee joint itself, a number of the muscles will actually project out medially and then curve back in at a bit of an angle. And for that reason, that particular margin is sometimes known as the vastus medialis obliquus portion of vastus medialis, or the VMO portion of the muscle. So if you're looking at the structures that we just developed, this may sound a little strange, but I like to think of them as sort of a hot dog bun, where you have the deep part of the bun being the vastus intermedius, and then the margins of the bun that spring up being the vastus lateralis and vastus medialis. And of course, what's a good hot dog bun without a hot dog inside of it? So that's where our rectus femoris muscle comes in. Unfortunately, I have to draw this in black as well. I don't have much of a palette choice here. I would do this in a different color. Rectus femoris comes off of the anterior inferior iliac spine and also has a small little attachment off of the rim of the acetabulum. And then from there, the fibers will project down into the middle of our hot dog bun, lying over top of the vastus intermedius, which is why it's unfortunate that I have to use black here, to complete the quadriceps femoris group. So of the four quadriceps femoris, the first three vasti muscles are responsible exclusively for knee extension. Notice that the rectus femoris, because it also crosses the hip joint, is also responsible for hip flexion. That brings us to sartorius. Sartorius is a Latin term meaning tailor's muscle. It gets its name from the fact that its function puts an individual into a cross-legged position, similar to the way that tailors would sit when the muscle was first named. Sartorius is the longest continuous muscle within the body. If you think back to when we looked at the back musculature, the intrinsic back muscles, we talked about longissimus being the longest non-continuous or discontinuous muscle in the body because the fibers would start and stop partway through. With sartorius, the fibers all begin off of the anterior superior iliac spine and then attach along the medial aspect of the tibia. So from here it lies just on the outside of the vastus medialis obliquus, will actually pass posterior to the knee and then project again anteriorly to attach to this anterior surface. So because of the fact that it crosses anterior to the hip and posterior to the knee, this is actually a flexor of both the hip and the knee. and it will also cause lateral rotation at the hip. If you think about it and you put yourself into a cross-legged position right now, those are the movements that you're accomplishing. Knee and hip flexion and then lateral rotation at the hip. Hence the name talar muscle. Next we have iliopsoas. Unfortunately, you're only going to see a very small part of iliopsoas in the lab. This is actually buried within the abdominal cavity. It actually contains two portions. First of all, the psoas major, which originates off of the transverse processes of all of the lumbar vertebrae. And then the fibers run down and merge with the iliacus portion, which, as the name implies, originates off of the internal surface of the ilium. From here, all the fibers fuse together and form one common tendon known as the iliopsoas muscle or iliopsoas tendon. These will emerge deep to the inguinal canal to attach to the lesser trochanter. So this is the principal flexor of the hip. We have accessory hip flexors, but this is the one that really is engaged in hip flexion. It's a rather pronounced muscle, which you'll notice when we get to the abdomen. Very strong fibers to cause a very forceful contraction when it attaches to the lesser trochanter. Finally, we have a muscle called pectineus. Pectineus originates off of the superior ramus of the pubis and will insert, once again posteriorly, just past the lesser trochanter. So very much on the lateral surface. The fibers do pass anterior to the hip joint, however, so consequently this is also going to be a flexor of kinesthetic learning exercise for the muscles of the medial compartment of the thigh. These ones are primarily responsible with adduction, hip flexion, and hip medial rotation, although some do cross the knee joint and are responsible for flexion at the knee as well. First of these muscles we'll look at is a very small one, and again, it's something that is not going to be the easiest thing to find in lab. It's called the obturator externus. Its name implies it comes off the obturator foramen on the external surface, and as we'll see when we look at the gluteal region that there is an obturator internus as well. From here, it's actually going to attach just on the inside of the radar trochanter. So it actually passes posterior to the joint. So as a result, this is one of our exceptions here in that it tends to be a lateral rotator of the thigh as compared to being a medial rotator, which the majority of them will be. Next, we're going to look at our true adductor muscle group. There's three separate muscles, and we'll look at the deepest one first for the sake of drawing it in. It's the adductor magnus. Origin point is off of the inferior pubic ramus and the ischial ramus, and it has a broad insertion point. A large portion of the muscle is actually going to insert just medial to the linea aspera along the back, which we've already been talking about. But there's another distinctive band of muscle which will actually attach just superior to the medial epicondyle in a region known as the adductor tubercle. When we look at these two regions, we typically call the region that attaches along the length of the femur the adductor portion, and then this region here that actually attaches into the adductor tubercle is sometimes known as the hamstring portion. So the adductor portion is going to adduct, of course, and it's also going to be responsible for flexion and medial rotation of the hip, but the lower part is going to actually result in flexion of the knee as well. And notice that we have this region between these two bands, which is sometimes called the adductor hiatus. Next muscle to look at is the adductor brevis muscle. This gets its origin, once again, off of the pubic bone, more towards the body than what we saw with the adductor magnus. And it's going to have an insertion point once again just along the medial line of the linea aspera and medial to the adductor magnus. And so again, adduction, medial rotation, and slight flexion of the thigh. That brings us to adductor longus. This muscle is going to insert superior to the brevis, and its insertion point is going to be inferior to the brevis, right along the same lines. So as a result of this, it actually has a partial overlap with the brevis. And although we can't really draw it in here, if we think of the pectineus that we saw from the previous example, which is going to have a very similar function to what we're seeing, pectineus is going to lie just on the superior border of adductor longus. So if you split pectineus and adductor longus, that allows you to see the brevis from in between. Next we have a muscle called gracilis. Gracilis is going to come off even more medially. Running out of colors again, but we'll do this one in red. So it comes off primarily of the pubic bone itself, and then it's going to run straight down, posterior to the knee. This is important for its function. And then this is going to be the second muscle that attaches to our goose's foot, the pes anserinus. So because of its location and its orientation relative to the knee joint, it's going to be a slight adductor of the thigh, but it's primarily going to flex the knee and also result in a little bit of medial rotation. Kinesthetic learning exercise now to look at the vasculature for the anterior and medial compartment, and we'll actually be looking at the vasculature for the posterior compartment as well. As we'll talk about when we get to that area, it doesn't have a direct blood supply, but rather relies on perforating branches from the anterior and medial compartment. The principal artery in the anterior medial compartment is the femoral artery. And if you go back to the cross-section that we showed towards the beginning of this discussion, you'll see that it basically travels between the anterior and medial compartments. So we have that muscular septa which divides anterior and medial compartment musculatures, and this is where the neurovascular structures generally run. Femoral artery starts, as we saw in the femoral triangle, and we said it was basically on the midpoint of that subinguinal canal. So if we take a look at the inguinal ligaments, the femoral artery would be basically in the middle of the structure, right anterior to the hip joint itself. It has a fairly large, extensive course down the medial aspect of the leg, again between those two compartments that we've been discussing. And it doesn't exactly terminate, but it experiences a name change as it passes between the adductor and hamstring portion of the adductor magnus muscle. So we call this the adductor hiatus. And so what we'll notice is that the femoral artery will actually pass through the adductor hiatus and then pass posterior to the knee. And the point at which it crosses the adductor hiatus, it experiences a name change that we'll be discussing in a later podcast. We're concerned right now with the branches that are coming off the femoral artery in the anterior and medial compartment. First principal main branch is profunda femora, meaning the deep artery of the femoral region or thigh region. It comes off just distal to where the femoral artery passes the hip joint, and as the name implies, it's going to travel a little bit deeper in the anterior compartment relative to what we saw with the femoral artery. As it does, it will give off certain sub-branches. First is what's called the medial and lateral femoral circumflex. They can come off the femoral artery itself, but they're most commonly found to come off the profunda femora. And as the names imply, one travels medially to wrap around to the posterior aspect of the femoral shaft, and the other one comes out directly laterally and wraps around the anterior portion of the femoral shaft. So very similar to what we saw with the anterior and posterior brachial arteries, but note the difference in the name that we see here. Looking a little more closely at the lateral femoral circumflex, we see that it has a couple of branches that come off of it directly. First, we have this transverse branch that we've already drawn in, but in addition, we also have what's called the ascending branch of the lateral circumflex. This is, as the name implies, going to hook upwards towards the head and neck region and supply blood to these structures. And we also have a descending branch of the lateral circumflex artery, which is going to travel down on the lateral aspect of the leg, provide blood to muscles within this region, as well as form anastomoses around the knee, which we'll be talking about in another podcast. Finally, we talk about several perforating branches associated with the profunda femora. Now remember that I said off the top that the posterior compartment doesn't have direct blood supply. What it actually receives are these perforating branches that come off. There's typically around 4 to 5 of them along the length of the profunda femora, and they will actually penetrate through the adductor magnus tendon on the medial side, the adductor portion of it, and project through to be able to supply blood to the posterior